I'm Robin Shooter, founder of Empower Total Health, and I'm devoting this, which is my fifth update on the fifth International Plant-Based Nutrition Healthcare Conference, which was held in Anaheim, California in September 2017, to just one presentation, which was called Alzheimer's Disease and Diet, New Research Frontiers. And it was by husband and wife researchers, Doctors Aisha and Dean Sherzai. Now, dementia in general and Alzheimer's disease in particular is probably the condition that people fear the most as they get older. Anyone who has ever watched a loved one succumb to the ravages of dementia would probably give their right arm to avoid it. As it turns out, though, you don't need to sacrifice a limb to stave off dementia. You just need to implement the same healthy lifestyle strategies that protect you against heart attack, stroke, type 2 diabetes, and many common cancers. Aisha and Dean Sherzai are co-directors of the Brain Health and Alzheimer's Prevention Program at Loma Linda University in the heart of the only blue zone in the United States. The blue zones, in case you've never heard of this before, are 5 regions in the world that boast the highest percentage of centenarians. In the blue zones, people don't just have unusual longevity, they remain in unusually good health until near the very end of their lives. Loma Linda, which is in the greater Los Angeles area, is home to a large population of Seventh-day Adventists, or SDAs. They're a Christian denomination whose religious teachings emphasize the importance of caring for the health of the body as the temple of the soul. Rates of cigarette smoking and alcohol use are extraordinarily low among SDAs, and up to 50% of them practice vegetarianism in some form or another. Now, strikingly, of the more than 2,500 patients that the Sherzais are currently tracking in their brain health clinic, less than 1% of those with cognitive decline were vegetarians who were already following a healthy lifestyle at the time they enrolled in the Sherzais program, which is testimony to the effectiveness of a healthy vegetarian diet and other health promoting practices in preventing cognitive decline in the first place. The poster child, if child is the right word to apply to a 103-year-old man, for the benefits of a healthy plant-based diet and active living is Dr. Ellsworth Wareham. He was a pioneer in cardiothoracic surgeon who, as the Sherzais explained, continued to perform open to close surgeries. So from taking a surgery from the initial incision to sewing it up afterward, which is pretty intense. He was still doing that at Loma Linda University's medical center until well into his 90s. And then at that point, he decided to retire so that he could spend more time with his wife and travel. Pretty cool. He's been a practicing Seventh-day Adventist, and he credits his long and healthy life largely to having adopted a vegan diet in his 1950s, so it's never too late to change. Now, while Dr. Wareham's story is uplifting, the Sherzais had some pretty depressing news to share about dementia. In the US, as in other developed countries, an aging population is leading to increased rates of Alzheimer's disease and vascular dementia and stroke and Parkinson's disease. However, it's important to understand that aging does not cause these diseases. It just increases the risk of developing them because older people have been exposed to the causes of these diseases for a much longer period of time than younger people. Alzheimer's disease is now the 6th and, based on new data, possibly even the 3rd leading cause of death in the US. It's not far behind here. 1 in 10 Americans over the age of 65 has Alzheimer's disease, and nearly 1 in 2 of those aged over 85 are suffering from Alzheimer's. And while mortality, or the death rate from other chronic diseases such as cardiovascular disease and cancer, has been declining over the last few decades despite an increased incidence of these conditions, mortality from Alzheimer's disease is actually rising. In fact, there was an 89% increase in deaths due to Alzheimer's disease between the year 2000 and 2014. There is no successful medical treatment for Alzheimer's disease. The failure rate of drugs that were developed to treat it in over 400 clinical trials running from 2000 to 2012 was 99.6%. And in reality, as the Scherzais pointed out, the failure rate is actually 100% because no drug actually slows or stops Alzheimer's disease. Even so-called successful drugs only treat disease processes such as accumulation of beta amyloid protein without restoring the function or affecting the clinical outcome of the person in any way. The Scherzais stress that the amyloid plaques and the neurofibrillary tangles that have been the major targets of Alzheimer's disease research for the last several decades are the wrong targets. These phenomena are the result of the Alzheimer's disease process rather than the cause of it. So what does cause so many people to lose their cognitive function as they get older? And what can we do to prevent this process? The first thing to realize is that dementia is not a normal part of getting older. Normal aging does cause a mild slowing of processing speed. It takes a little longer than before to find things in your mental filing cabinet, but all of those things are still in there and you can retrieve them. It just takes a little longer. Mild cognitive decline, or MCI, is an intermediate stage between normal aging and dementia, and it is reversible, whereas, at least at this point in time, the Scherzais do not believe that full-blown dementia can actually be reversed. The Scherzais explained that the brain is under much more stress than other organs in the body due to its incredibly high energy and waste disposal needs relative to its weight. So the brain's pretty busy for how small an organ it is. That's the bad news. The good news is that the brain also has great resilience due to its high capacity to make new neuronal connections. This is a phenomenon known as neuroplasticity. And changes in lifestyle have a huge impact on brain health and therefore on cognitive function. Here's a summary of the research the Scherzais presented. In the 1993 Adventist Health Study, consumption of animal products, including white meat such as chicken and fish, doubled the risk of dementia compared to those who were eating no animal products. The Chicago Health and Aging Project study found that a 2.2 times higher risk of Alzheimer's disease in those people with the highest intake of saturated fat, the kind that's found in large amounts in animal products, but also in solid vegetable fats like coconut and palm oil. The Women's Health Study found that those with the highest saturated fat intake had a 70% faster rate of cognitive decline. And in general, saturated and trans fat intake increases the risk of dementia, while plant fats decrease that risk. Sleep apnea, which is usually associated with obesity, increases the risk of Alzheimer's disease by 70%. Insulin resistance is also strongly linked with dementia. In fact, some researchers are now describing Alzheimer's as type 3 diabetes in recognition that insulin resistance within the brain and disturbances to brain glucose metabolism severely impact cognitive status. The Scherzais cautioned against adopting a ketogenic diet, that is a very low carbohydrate, high fat diet. This has been promoted as being good for the brain and even a potential therapy for Alzheimer's disease. There's no research to actually validate those claims. The Scherzais acknowledge that in the short term, people may feel better on a ketogenic diet because ketone bodies cause more alertness. However, in the longer term, ketogenic diets cause microvascular damage, so damage to the small blood vessels, inflammation, and they harm the microglia, which are the brain's immune cells. And previous research has shown that the saturated fats that ketogenic diets are very rich in are strongly related to these abnormal proteins that accumulate in Alzheimer's disease. The Scherzais referred to research on the MIND diet. It's a hybrid of the Mediterranean diet and the DASH diet, which stands for Dietary Approaches to Stop Hypertension. And these so the MIND diet emphasizes fruits, especially berries, vegetables, in particular green leafy vegetables, legumes, whole grains, nuts and seeds, and it limits animal products geared most closely to the MIND dietary pattern were found to have a 54% lower risk of developing Alzheimer's disease. And even those who kind of stuck with it half and half did have a lower risk of Alzheimer's disease than those who showed least adherence to this pattern. In their program at Loma Linda University, the Scherzais take an integrated approach to prevention of cognitive decline. They teach people with mild cognitive impairment, that intermediary state between normal cognitive function and dementia, to adopt a whole food plant-based diet along with regular exercise, meditation, restful sleep, which they really stress the importance of. During sleep is when our brain kind of hoovers out all the detritus that is accumulated during our waking hours. And if you don't take out the garbage in your brain, that accumulated garbage actually contributes to the pathologies we see in Alzheimer's disease. And they also include cognitive stimulation in their program. And they've achieved really remarkable results with arresting and even reversing cognitive decline. If you catch it early enough, you can prevent the slide from mild cognitive impairment into dementia. It really should come as no surprise that we can prevent age-related cognitive decline with a healthy diet and lifestyle. After all, the brain is an organ. It's like any other organ in the body. It's dependent on a constant supply of nutrients and oxygen, and it requires constant removal of its metabolic waste and protection against external toxicants. That's bad news for the pharmaceutical industry, which is never going to find a cure for Alzheimer's disease. But it's good news for us because we're in charge of what we eat and how much we move, rest, sleep, and use our brains. So please do like and share this video with everyone you know. Alzheimer's disease and other forms of dementia are just cutting a swathe through our population. The problem is only going to get worse until we all take responsibility for our well-being and adopt habits, the earlier in life the better, that actually protect our brains for the rest of our lives. Thanks for listening, and I'll catch up with you for next week's weekly update.